We have to make sure that the politicians are held accountable.
Every administration had the ability to put a ban on asbestos.
When it comes to asbestos, it really is about power, money, and politics.
And next, I'd like to introduce Dr. Paul Demers. We are recently fellow countrymen, or at least I'm recently Canadian. Dr. Demers has done a lot of work with asbestos and other carcinogens, and very important work looking at interaction between different carcinogens in the same workplace. So, Paul.
Thanks, and I want to thank everybody for being here today, and I want to thank Linda and the ADAO for inviting me to this event. You know, I like to tell people that I'm usually very proud to be Canadian, and the one time really where I am not is when the history of asbestos in Canada comes up. At that point, it's I actually feel quite ashamed for our history. Canada was the major producer for a number of years, or major miner of chrysotile asbestos, and a major exporter as well. But this is actually our graph of domestic use of asbestos over the years. It's very similar to the one you saw for the United States. You see a peak there around 1970, and then kind of a rapid drop. The very steep drop there was the closure of most of our mines and a lot of usages, and so by 1990, really the only mines left in Canada were in the province of Quebec, and those, I'm happy to say, ceased operation about 6 years ago. So we are making progress, and today I'll be talking a bit about the impact that asbestos use has had over time here in Canada, I shouldn't say here, I'm south of there, and as well our moves towards banning asbestos, which we hope will happen later this year. Now, one of my major responsibilities I see as a health scientist opposed to asbestos is to really generate the numbers and the facts and figures to be able to supply to the rest of our colleagues who are opposing asbestos. And this is probably one of the simpler things, because we actually have very good registration of cancers in Canada. This is the number of mesotheliomas that are diagnosed annually, the rate which constantly increases over time, and then the numbers which more increases steeply over time. In fact, in the most recent year of statistics available, we have over 550 mesotheliomas diagnosed each year in Canada. And for those of you who aren't familiar with the size of Canada, we're about 1/10 of the United States. So about the population of the state of California is our population. Now, about 5 years ago, we began a large project funded by the Canadian Cancer Society to try to estimate what we call the burden of occupational cancer across Canada. And burden sounds like a common word, but it's actually a bit of jargon when it's used in health research, and it's really the number and proportion of cancers, in our case, that were due to workplace exposures. So we are a workplace research center. And as well, we had a big component in this research of looking at the economic costs of those cancers. And that part of it was actually headed up by the Institute for Work and Health, which you see their logo there. But this was really a national team effort involving researchers from across Canada. Now, we do, I think, a fairly good job of counting the number of mesotheliomas in Canada, but we also wanted to look at what the causes were of those mesotheliomas. And really the only recognized and well-established cause of mesothelioma is asbestos or asbestos-like exposures, other minerals that are very similar. Asbestos is only a commercial term, It doesn't cover all the asbestos-related minerals. It's not really mineralogical. It's been a problem for Libby, Montana, for instance, where there are other forms of asbestos-like material, fibers that are not counted. But in any case, we looked at the what we thought were the best studies that tried to look at the history of exposure in patients, in large groups of people who have been diagnosed with mesothelioma, and came up with these kind of approximate numbers that about 85% of mesotheliomas in men were due to exposure at work, about 40% in women, another 20% in women likely due to what we call para-occupational, which is just a way of saying exposure at home from people, other members of the family bringing asbestos contaminated clothing home from working at asbestos facilities. So this is kind of how we divided it up in our models of trying to estimate what the impact of asbestos is. But when you look actually at studies that have been done of asbestos workers at a variety of different industries, and there are a lot of studies of these over time, what you see is that in those studies, for every case of mesothelioma, and these are what we focused in was on the, we call the North American studies, the American and Canadian studies only. For every case of mesothelioma, you see almost 5 excess cases of lung cancer, which are much less frequently recognized by our workers' compensation system. But this is the other biggest impact of exposure to asbestos. And so this is what we came up with in our research. And what that adds up to, you'll see 2011 here because we had to pick a year to focus in on, and we hold our census in Canada in 2011, and in the years ending with 1s and 6s every 5 years. So we kind of flagged it or kind of tied it to that year. But based on that year, what we're then seeing is 430 mesotheliomas due to work and 1,900 lung cancers. So that's the numbers in a single year in Canada. So again, if we're similar here in the United States, just add a 0 to that because it's 10 times higher. Now, one of the aspects of our research that we thought was important to do was to look at the economic impact. And I'm not an economist, I'm a health researcher, I'm an epidemiologist, and an industrial hygienist as well. But our economic team tried to estimate really what the costs were in economic terms. And this is important, in terms of really trying to drive and make our case for the banning of asbestos, and it definitely has had an impact on that. Although I think everyone in this room would agree it's really the people getting cancer that is the important part. We did try to cost this out. And what we're looking at is what are the current and future costs of each of those cases of mesothelioma and lung cancer, and we focused on those two. And those would be costs not only to the worker or former worker who had been diagnosed, but to their families, to their communities, to their employers, and to the society at large. So we're trying to look at this in a very comprehensive way. And the types of costs that we were looking at were healthcare costs, what we call administrative costs, that is the cost for doing things like processing, compensation cases and other things like that. Informal caregiving, so the cost of families to take care of family members, out-of-pocket costs that aren't covered by our healthcare system, which is a universal healthcare system in Canada. The output and productivity loss in terms of on our economy from people being pulled from the workforce. And then, most importantly, the health-related quality of life costs. So that's trying to really put a cost on the value of life and the loss of quality of life, which is not an easy thing, but Economists do have formulas for trying to do this, and these are commonly taken into account in other types of economic studies. And this is how it breaks down. This is how it breaks down. In fact, you see that, healthcare costs in Canada, and this kind of washes out. These are circles here. You may not be able to see that. And these are Canadian dollars, which aren't worth quite as much as US dollars. But for every case of lung cancer, we're saying $980,000 in cost, and for every case of mesothelioma, $1.1 million in economic costs. With the majority of it, 2/3 of it or 60% of it in the case of mesothelioma, really related to health care or health-related quality of life. So that's really where most of those costs really focus. Now, that's actually come into play because I'm feeling a little bit better about being a Canadian these days, because we are moving towards banning asbestos in Canada. And thank you. This has been a long time coming. It's involved the effort of a lot of different folks here. A friend and colleague of mine, Aliaga, has put an enormous amount of work into this, but we've been working on this issue for many years. And I apologize, don't worry about reading the fine print there. It just this is kind of to show that it's real. This is a Government of Canada website. They announced 2 years ago that they were moving forward on a ban of asbestos, and it's actually going to happen later this year. It's not perfect. It covers a lot of the use and sale of asbestos, but there are some issues that I'll mention at the end of this talk that we're still trying to work on, but at least it's real, and at least we're moving forward finally. One of the things that we moved forward on more early was having a national inventory of asbestos in federal buildings. This followed the province of Saskatchewan actually enacting a provincial registry of a similar kind. At this point, it's just government-owned or leased buildings, but at least it represents a step forward in trying to raise awareness about just how widespread asbestos is in our buildings. These examples that you saw from Celeste's presentation a little bit earlier that were, dramatic things about how people are exposed from asbestos that still exists in buildings, things that are not going to be impacted by the ban on asbestos, are really things that occur on a daily basis. Certainly in the United States and Canada. I was recently doing some work on asbestos in schools, and I was told by the head of the Toronto District School Board, not the head, but the head of health and safety for the Toronto District School Board, that if there's a leak in a school and a ceiling falls down, they have to do a fire drill and they evacuate the school. Because there's so much asbestos, they have to make sure that there wasn't asbestos in that ceiling after it fell down. And then classes, if there is asbestos that was above there, and they do try to record and keep track of where it is in all the schools, classes have to be held in another school board building until that school is repaired. So the majority of our schools were built prior to the mid-1970s and have asbestos in them across Canada. Our hospitals, our public buildings. So these examples happen on a daily basis. So what we really need is a registry that includes not just government buildings, but includes all buildings that have asbestos, so that if a situation happens, people are aware of the asbestos that's in the school. We keep track of things and remove it as soon as we can. And if there's a fire, emergency responders will know that there's asbestos there. So we have a lot of challenges remaining, I think. So with Canada, with these proposed regulations, we'll join over 50 countries that have banned asbestos. It's a growing number, and we're very happy about that. But we're still estimating that over 150,000 workers across the country are kind of regularly exposed to asbestos. And these are people primarily in construction and involved in the remediation or the modification of existing structures where they'll encounter asbestos. There are many more if you include all the custodians, our skilled trades people who maintain our schools and buildings, who are exposed to asbestos on a more intermittent basis. So there's still very large numbers out there. They're with a high potential of exposure and more going on over time. When I first became an occupational hygienist back in the, industrial hygienist we would say here, back in the mid-1980s, over 30 years ago, there was a philosophy of leaving asbestos in place if it wasn't friable, if we didn't think that the fibers could become loose. And with the idea that we would create more harm than good by doing that. The problem is that it's over 30 years later, and those buildings are gradually aging over time, and we still haven't removed a lot of that asbestos that is still out there. And I think we have to take a much more aggressive stance on removing asbestos and that kind of, really terrible legacy, and I don't have a better word yet, of asbestos that we're facing. The ban on asbestos that we're putting in Canada still has some challenges in it. There are over 800 million tons of what they call asbestos residue, or tailings with asbestos in them from our mines that aren't dealt with properly in this ban that's coming up, that we're trying to kind of rectify as it goes forward. They've given 7 years to the chlor-alkali industry, which is tiny in Canada. It's a single plant in the province of Quebec that still, has permission to use asbestos. We need to address that. There are a number of different things that we'd like to fix, and these remain as challenges, but at least I'm happy to say that we're moving forward on this. So I want to thank everybody here for allowing me to be here. My center is funded by mostly by the province of Ontario, which is the province where Toronto is and where my office is. And also we've received very important funding from the Canadian Cancer Society, which has taken a very strong stance against asbestos. So thank you very much for your time today.